Hello, my name is Spencer Chin, and today I will be talking about temporomandibular joint disorder. The temporomandibular joint is commonly referred to as TMJ, and it is our jaw joint, one of the most commonly used joints in the body. The TMJ acts similar to a hinge by connecting our jawbone to the skull. It is composed of the condyle of the mandible, which is our jawbone, the articular tubercle of the temporal bone, which is part of the cranium, and an articular disc. This disc is important as it assists in stabilizing the movement of the jaw and providing a cushion to absorb stress. This allows for the TMJ to have a fluid, smooth movement. The TMJ allows for various movements of the jaw, such as side to side, up and down, as well as protrusion and retrusion. In addition, various muscles are associated with the TMJ, which allow more complex movements needed for speaking, chewing, and making facial expressions. So temporomandibular joint disorder can be defined as any problem that prevents the complex system of muscles, ligaments, bones, and joints in the TMJ from working together properly. So what causes TMJ pain? Well, there are three distinct causes. The first cause of TMJ pain is from myofascial pain, which results from increased muscle tension and spasm in the muscles around the jaw joint. It is believed that psychological stress may be an important factor. Stress could lead to nocturnal jaw clenching and teeth grinding, which causes spasms of the chewing muscles. The second cause of TMJ pain is internal derangement. This means that the problem is in the joint itself, and usually involves a displaced disc, dislocated jaw, or injury to the condyle. The shallow socket of the TMJ allows for easy movement of the jaw, but the trade-off is that it is not very stable. This results in it being the most easily dislocated joint in the body. The third cause is degenerative joint disease, also known as osteoarthritis. This is a wear and tear arthritis in which the cartilage at the articulating areas of the mandible and temporal bone would slowly start to degenerate over time. Now, what are some symptoms of TMJ disorders? TMJ disorders can affect one or both sides of the face, head, or jaw. There may be chronic pain in the muscles used for chewing, and it is usually described as a dull ache. Pain may radiate to the ear and jaw and worsen with chewing. The jaw may lock up when attempting to open the mouth, and the patient would have limited range of motion for the jaw. There may also be clicking and popping sounds when there is displacement of the articular disc. The bite would feel uncomfortable or unusual. However, there is no scientific proof that sounds such as clicking in the jaw joint lead to serious problems. In fact, jaw sounds are common in the general population. Jaw noises alone, without pain or limited jaw movement, do not indicate a TMJ disorder and do not warrant treatment. There may also be bruxism, which is excessive teeth grinding or clenching of the jaw. Let's talk about treatment. The good news is that symptoms of TMJ disorder actually goes away over time, with or without treatment. Almost half of patients have improvements in their symptoms and within 1 year, 85% in 3 years. So common medication include pain relievers and muscle relaxants to help relieve pain. Some therapies that are used include bite guards. These are also called oral splints, and these are either soft or firm devices that patients insert over their teeth. Physical therapy would help teach patients how to exercise and strengthen their jaw muscles. And if these methods aren't working, there are more invasive methods, and these include injections of steroids into the TMJ or surgery to repair the joint. So now let's talk about some lifestyle changes that can be implemented. So the first change is avoid overusing jaw muscles. This means eat softer foods, cut food into smaller pieces, and staying away from chewy foods such as gum. We can also do stretching and massage. So when patients go to a physical therapist, they will learn how to help stretch and strengthen muscles at home. They could also apply heat or cold to their face to help reduce pain. Let's go over some statistics in regards to the TMJ in the United States. It is a very common disorder affecting around 10 million people. Almost 1 in 4 people will have symptoms of TMJ disorder sometime in their life. It is far more common in women than men, with there being a 4-to-1 female to male ratio for TMJ disorder. So one study actually tried to figure out why there's this sort of disparity, and it found that estrogen, a female hormone, may cause increased cartilage and bone degradation. So to conclude, I'd like to say that more research needs to be continued to see how we can better treat and prevent TMJ disorders in the future. Thank you.